In this episode of the Courageous Public Health Podcast, Dr. Sandte Stanley, public health scientist, sociologist, and founder of Atlas Collaborative Consulting Network, shares how courage has guided every step of her journey. She talks about discovering public health through an ACEs internship, navigating personal loss during graduate school, and later earning a PhD in sociology so she could ask the structural questions that public health can sometimes overlook. She also reflects on how her identity as a Black and Native woman shapes her experience in professional spaces, where her expertise is sometimes doubted, dismissed, or even echoed back to her, and why she continues pushing for solutions, community power, and accountability anyway. Dr. Stanley names a future where communities lead, data tells the truth, and public health finally does what it was always meant to do: serve the people. You are listening to the Courageous Public Health Podcast, episode 38. To all the courageous women leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I am an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have real, unfiltered conversations with women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then listen to this new episode. Hi, everybody. Thanks for joining me today. I'm Dr. Christy McClamrock, CEO of Courageous Public Health. Through my consulting work, I support public health teams with workshops, facilitation, and speaking engagements all around courage. I can't wait for you to meet my guest. So I'm going to give you a formal introduction, and then we will get started. Dr. Sandte Stanley is a behavioral and social scientist whose career reflects a deep commitment to equity, leadership, and meaningful change. With a PhD in sociology and Master of Public Health, she has spent her career advancing disparities research, designing transformative programs, and championing the power of stories to drive impact in communities of color, for women, and across intersecting identities. As the founder and principal consultant of Atlas Collaborative Consulting Network, Dr. Stanley helps organizations design intentional curricula, evaluate programs, and develop leaders through a lens of inclusion and systems change. Her work bridges data and humanity, creating spaces where evidence, strategy, and lived experience intersect. Outside of work, she loves to travel the world, brunch, and spend time with her family, found family, and her dog Pepe. She's also a proud citizen of the Muskogee Creek Nation. Ready to be inspired? Let's go. Let's get to it. I'm very excited to introduce my guest today, Dr. Sandte Stanley. Hi, how are you?
I'm good. How are you?
Yeah, I'm good. We were already talking about how we both are wearing green today, and appreciating that there are like tiny little hints of fall coming. That's exciting. And I'm really glad you're here. And I want to do a quick shout out for Dr. Pascal D. Edouard for introducing us. So
yeah, she's fantastic.
Yeah, absolutely. She was a guest not too long ago. And I always say how much I love meeting new people through my guests. So fantastic. Well, I want to give you a chance to introduce yourself.
Yeah, so I am Dr. Sandte Stanley, and I am very happy to be here to, share my journey, traveling through public health and traveling through social sciences to end up back in public health and kind of, where that journey has taken me and building my own business, out of, nothing from the ground up. So happy to share things that helps others.
Yeah. Oh my gosh. I'm very excited that we get to dive into all of that today. That's great. So with that, let's jump into the first question because it's totally, related to what you're talking about. So, I like to remind our listeners, about the difference between bravery and courage. So bravery is about taking action without fear, and courage is about taking action despite fear. And, there's a lot of there are a lot of things that cause us fear. So I think courage is very relevant these days. So I'd love to have you share some experiences from your life, your personal life, where you've acted courageously.
Yeah, so, I never really know what is courageous or what is brave until after it's done and somebody tells me that that's what it was. I'm usually just doing what I think is best or doing what I think is right in the moment. And that's kind of how I've lived my entire life. And so, mostly the thing that has carried me through like my life journey has been my education. I'm a first generation college student. I started at Michigan State, go green. And then I had an internship at CDC. I was studying social psychology when I was at Michigan State, and that journey led me to better understand, hey, you could be a clinical psychologist, you could do research or study health in many different ways. And so I wanted to get kind of like a practical understanding of that. So I went to CDC and completed the American Indian Science and Engineering Society summer internship, ACEs. And that I found out what public health was through that. And that changed the trajectory of my career, that experience did. So shout out to ACEs for changing my life, and shout out to CDC for changing the trajectory of my life. And so going from psychology to, public health, something that I didn't even know existed, and then applying to Emory and going to public health, going to Rollins, was really a major switch, having to learn a different discipline, but something that kind of like connected together. There are lots of overlap there. It was an interesting journey, right? Because I didn't have, I was a McNair scholar, but besides that, there was nobody to tell me, what I was doing was wrong, or what I was doing was going in the right direction. And so I was just kind of, thinking one step at a time. And it seemed like the right step to go to Emory and study cancer and study prevention programming and things like that. And so that really kicked off my journey. And then actually working for CDC after that. And during that time, my dad died. And so during that whole process, I was, kind of, I felt like I was floundering because, I was going through probably one of the most difficult things personally. Yeah. My dad was battling cancer. And so it was it was really difficult. I was journeying from Atlanta when I was supposed to be in biostats class, and going to Indianapolis to, sit in the hospital and make sure that he was okay. And it was just a really hard time. But, I feel like it made me a stronger student, and it made me a stronger person to have to deal with that. And so after my dad passed and I, completed my thesis and went on to move on to CDC, I kind of like carried with me all of these questions about how race, how socioeconomic status, how all of these different things impact health. And so I'm asking all these annoying questions while I'm at CDC. I'm like, okay, I love that we're looking at, cancer prevention programs. I love that we're talking about health disparities. At the time, there was an Office of Health Disparities, and they changed it to Office of Health Equity. Yep. And so I'm like, I love that we're talking about this and I'm working on these things, but are we talking about education? Are we talking about housing? Are we talking about like these systemic problems? And how are we connecting with HUD? How are we connecting with all of these different organizations? And so everybody was like, yeah, we do that. Just focus on your research. And people, there were many people there who, supported my line of inquiry and supported my suggestions and questions, but there wasn't really a tangible way for me to make space for that. Yeah, and so one of my colleagues pulled me aside and said, you're asking a lot of sociological questions. You're asking a lot of structural questions. Maybe you should consider getting a PhD in sociology. And so that's what I did.
Amazing.
And so I moved on. I got a PhD in sociology. I focused on mortality disparities, education, intersectionality, gender, all of these different things. I learned so much about, these structural pathways to why it is that we see cancer disparities, why it is that we see all of these different things that we see, and what exactly it is that we can do about it. And so moving back into public health as a consultant for CDC and as a consultant for state health departments was, to me, like the next logical step, because I wanted to take everything that I learned in sociology about structure, everything that I learned from the experience in being in the hospital with my dad, and move that into, what can we do with all of these like macro level things that we're seeing? What can I do to make it better and hold space for people of color, natives, for women, for the trans community? What can we do? And so then I started asking more annoying questions. It's like,
and we say annoying in like the best possible way.
I mean,
quotes. If you're listening versus watching, I'm doing like air quotes for annoying because they're actually fantastic questions.
Yeah, so I mean, creating, one of the things that I've tried to do in every single institution that I've been at, including, the universities that I attended, and being at CDC, being at my job at a nonprofit, is trying to bring in the voices of the folks that we're trying to help. There's only so much that you can do with a subject matter expert, right? A subject matter expert who came from a university and isn't necessarily part of the community, and is carrying privilege with them. And so I've always encouraged, let's make a space at universities, let's make a space for students. There's no space for Native students. We're a very small population in every university I've ever attended. So I'm like, let's start an ACEs, let's start NASO, let's start these spaces, let's start a Black Graduate Student Association. Let's talk to each other to encourage more people of color, more women, more folks to come in and hold these conversations, because I truly believe that's what public health needs. I think that's what every, discipline or area needs is more voices, more community. And so at the nonprofit, I became a chairperson of the Racial Equity, Diversity, and Inclusion Alliance. And so integrating into that, let's talk structurally, what are we doing to make this an organization that's focused on equity? Who are we hiring? Are those practices equitable? And, are we bringing in the voices of the communities that we're trying to help? So constantly trying to make space for folks, constantly trying to, take everything that I know and help people, because I feel like if you're not helping the communities that you're researching or that you're talking about, then what's the point?
Right. It's funny to me that you started off by saying that you don't always recognize your own courage, right? Like you need someone else to say, hey, that was courageous. And you're like, so I'm wondering, so if somebody, because you just shared so many examples of courage, right? Like I'm like, ding, ding, ding in my head. Like, that's courageous. Oh, wow. So how does it, so when people do stop you and say, hey, that was really courageous, like, how does that land on you? Like, how does that feel?
I mean, I think that at first it's like, really? because in my head, as I'm doing something, I don't take it as being courageous, and I don't take it as being brave. I take it as doing what's necessary and doing what needs to be done. And so if that's bravery, if that's courageous, then that's great. But it's not the reason why I'm doing anything. So it's never the perspective that I have. But if people on the other end are afraid to, use their voices in order to ask these questions that, senior leadership or people may be uncomfortable with, then I am more than happy to, show people that on the other end of this, there's something so good that it's worth the risk. It's worth the risk to ask the questions, because you could be saving somebody's life.
Absolutely. Yeah. 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 Well, okay. I want to transition to the next question, which is related. So, courage is also about authenticity, right? And claiming and expressing your power. And that's particularly true, I think, in spaces that may not always welcome it. And so I wonder if you could talk a little bit about how you feel like you express and embody your courage, and, some of the challenges that you faced and how you've navigated those. You touched on it a little bit, but yeah, if you could go into that a little bit more, it'd be great.
Yeah, so I think one of the major things that I lean into is definitely my identity, especially doing intersectional research. It helps me kind of think about, my place as a woman, as being Black, as being Native, as being highly educated, and saying in some ways I'm very privileged, and in some ways I'm not. And sometimes people don't want to hear, what I have to say, or they don't believe me. So being in spaces where I say something and then, a man says it in a different way, but the same thing. And I'm like, I just said that.
Oh, that's the worst.
Why would you do that? and so having to take those moments and kind of stand up for myself and say, oh my goodness, I love the way that you rephrased exactly what I just said.
Oh, that's great.
It's very encouraging to know that we agree on this issue. And so,
oh, that's such a beautiful response. Can I please borrow that? I want to use that. That's
everybody
great.
Take it. Everybody take it.
Everybody take it. Oh, that's so smart.
you have to reclaim what, your ideas and the things that you put out there into the world and into the universe, especially if it's going to be impactful, and especially if, it was your brainchild. And
Yeah.
so one thing that I always encourage people to do is, stake claim on your ideas, and don't let anybody take your identity, whatever it is,
Yeah.
trans, gender, or in any kind of capacity, and race, and belittle that in any way, or demean it.
It's so easy in the moment. I think it's so easy to like swallow that, right? It's like I mean, I've certainly done this lots of times where I just swallow it and I don't say anything. Because of course I do that partly because I'm afraid that if I say something, my like fury and rage is going to come out and like blow the other
Yeah.
person away. And it's like, there's actually a middle ground, which is what you just said, which is like, I'm gonna reclaim that and also do it in a way that leaves space for us to continue in relationship. And I think that's really important because when you
Yeah.
blow someone away with your like Godzilla force, like you can't really continue in the conversation.
Yeah, I need the conversation to
You need the
continue.
conversation.
I
Absolutely.
need, yeah, I need it to happen. And so I can't let someone's hurt feelings over something stop me from having a
Yep.
discussion about, why is it that Black women are more likely to die from breast cancer at advanced stages. I can't let somebody
Yeah.
stop me from having these different conversations. It's too important.
It's too
So
important.
priorities, and my priority is, hey, I'm going to be as diplomatic as possible, but I will not let you take my idea away from me. And we are
Yeah.
going to continue this discussion right after this
Beautiful.
brief message.
I love that so much. I'm wondering as you're talking about moving from public health to the world of sociology, how do you feel like the world of sociology has welcomed you in the public health part of you? Does that feel like that's been a smooth transition? Have there been bumps along the way? I mean, it's so fascinating to me when people do exactly what you've done, which is to have their training in public health, really bring that lens to some other area. And I've talked to a lot of women who've done that. It's really great and cool.
Yeah.
Yeah. So how was that for you?
Yeah, I think that there definitely have been bumps along the way for sure, because sociology focuses on the problem. Sociology is uncovering the issue. It doesn't necessarily always focus on solutions and being solution oriented.
Got it.
And so having to talk about a problem constantly, having to talk about disparities, and then having those frameworks from sociology to understand, okay, Durkheim says this or Weber says this, and it makes sense as to why these things are happening and why we see organizations working the way that they do, and how
Yeah.
that contributes to disparities, capitalism, sexism, all the isms.
Yep.
But then on the back end, wanting desperately to say, okay, what's next? What do we do next? How do we fix these things? Was definitely a challenge.
Yeah.
And so being able to talk about things like medical mistrust, and trying to say, hey, medical mistrust is extremely important. In sociology, we may not talk about it a whole lot, but given all of these structural issues that we talk about, this is addressing that is a solution to a lot of the disparities that we see. It could help mortality disparities. It could help disparities in chronic disease and things like that. And then, getting pushback about that, about like the research and about, how maybe, it needs to be more sociological. And I'm like, well, I mean,
I feel like what a beautiful pairing, public health and sociology, and that each one can sort of help with some of the disadvantages of the other, like or blind spots or like pieces that need more focus. So it does seem like such a obvious,
pairing, yeah. And I learned so much from sociology. I think that beyond these types of theories and things like that, really learning how to delve into a data-driven way to explain these problems and learning advanced statistical methodologies that I didn't necessarily learn in public health was extremely helpful, and something that I carry with me every day.
Yeah.
Something that I carry with me, in every job that I have, is that, okay, I definitely understand these larger issues. I understand, all the isms. Now here's a practical way for stakeholders to engage with that information by taking data and laying out the problem, and then being able to translate this difficult math into something that people can relate to and actually on the back end do something with, because we have to be able to do something with all of these things. We can't just talk about a problem and not solve it.
Yeah. Yeah, we're not doing that. We're not doing that anymore.
Let's not even get started on that.
We're not doing that anymore. I know. Oh my gosh. Yeah, I want to ask you, and you again like touched on this a little bit, which is great. So I want to ask you about your vision and thinking about the vision for public health. How do you see yourself and other women in your community, other Black Native women even, shaping this future? And then, of course, I like to end on what is your personal vision for your own future?
Yeah. So we're going to have a lot of work to do in public health. We've always had a lot of work to do, but I think at this point in time, there's going to be a need for transparency in the data. There's going to be a need for communities to really come together, utilize their voices, for folks that have been calling themselves allies to align with communities in order to bolster those voices, so everybody still gets their needs addressed, and that we're actually taking care of the problems and addressing the problems that communities actually face. And I think the future that we hold in public health is definitely a community focused, taking back the power of communities, helping communities, uplift them, engage with them in a really meaningful way. We cannot lose the voices of tribes. We cannot lose the voices of Asian, Black, Latino, trans, all of these different communities, all the LGBT community. We have to continue not only the conversation, but we also have to continue partnering and uplifting. And I think that is something that, we're going to have to continue to do as we see what happens on the back end of all of these changing of policies and the shifts that are happening right now, because we can't just rely on researchers expertise on this, we have to be able to talk to the communities and actually see what's going on and actually address their needs in a real way more so than before. We have to do that.
Yeah. Yeah, absolutely. Absolutely. So what about your vision for yourself? What's next for you?
So, I am continuing on my journey to really engage with or expand my outreach in terms of who I'm working with. And so right now, Atlas Collaborative Consulting Network is my business, and I do still focus on public health. I do talk about health outcomes, but I do also want to connect with many different types of foundations, think tanks. I want to be able to engage tech, because where we're moving right now with AI, where we're moving right now in terms of how we're speaking to people, getting data, looking at data, and what we're doing in order to transform programs, community-based programs, and things like that, and accessibility is really tied to technology and things like that. And so I want to continue the evaluation work that I'm doing, the UX research, in making sure that a lot of the websites, apps, and things that are happening are accessible to communities, and making sure programs are working, and making sure the data that we're getting is accurate and valuable, and to make sure that the next generation, the next crop of sociologists or public health scientists or whomever are getting the information that they need and the workforce development that they need. So really focusing my consulting work on engaging, doing trainings and seminars, but also focusing on evaluation work across the board, specifically with tech and how that pairs with public health, to make sure that we're still helping people, but moving forward in that help.
I love that. I love that for you. That's great. That's great.
I'm trying.
That's a great vision. You are. Yeah. Thank you so much for coming on the podcast to chat. This has been really interesting, and just like I get to be another person to say to you, like, you've done a lot of courageous things, and take that in.
Thank you so much for having me.
Yes. So I want to make sure that our listeners know the best way to connect with you. How should people connect?
If you would like to connect with me on LinkedIn, just look me up, Sandte Stanley, on LinkedIn, or feel free to visit my website, atlasccn.com, or shoot me an email. That's fine too, info@atlasccn.com. Either way, I am happy to talk, engage, and continue this discussion with anyone.
Fantastic. So we'll put all of that in the show notes, so it'd be really easy for people to reach out to you.
Thank you. Awesome.
Okay. Well, have a great rest of your sort of moving into fall day. And I'm glad we're connected now.
Yeah, thank you so much.
Sometimes courage is asking the annoying questions anyway, because the answers might save someone's life. Sometimes courage is holding your ground when people doubt you, dismiss you, or repeat your brilliance back to you as if it were their own. Sometimes courage is refusing to talk about problems without fighting for solutions. Dr. Sandte Stanley reminds us that courage means looking past symptoms to the systems beneath them, and daring to ask the structural questions that public health can't ignore. If this conversation sparked something for you, I would love to hear it. Leave a review on whatever platform you listen from. Your reflections help others find this podcast, and join us in building a more courageous public health. There are more powerful, honest, and necessary conversations to come. So thanks so much for being here. And until our next episode, stay courageous. Thank you for listening to the Courageous Public Health Podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.